So before we get into problem gambling and suicide and gambling disorder, I always set up the call with uh, the different avenues of gambling that are available in Illinois, right? Because we might have new folks on our call today who are looking to serve this population, or who are um, or who are interested in it and they don't know about gambling disorder and problem gambling. So there, there are four. There's actually five, but there's four avenues that you can gamble legally in the state of Illinois. And this is probably something you'd want to know if someone was coming to you, into your agency or practice, with a gambling problem, right? What's their drug per se? That they're, is it casino gambling? Well, we have 10 riverboat casinos, or 10 casinos anyways, in the state of Illinois. We have the lottery. Now, fun fact, did you know the Illinois lottery, I believe Illinois was the first state that would offer where you could purchase lottery tickets online. Video gaming. Do you know that we have the most video standalone gambling machines in the nation, more than Nevada? And then also racetrack, uh, well, before COVID-19, of course, were open and for business. So you could bet on horses at the actual track. I believe there's 3 to 5 of those out there still. A fifth option, which was part of the legislation and part of the reason that we now are bringing all these trainings to you, is that we have legalized sports gambling. That has now, the bill has been passed. Now, I knew it was set. I don't know if the trigger's been set yet or pulled yet because of the pandemic, but it was set to open the first part of this year, I believe. And in fact, I think you were going to be able to place a bet at the Hard Rock in Rockford, which was a new casino, one of the new 6 going up. But don't quote me, and if you know, you can chat me and let me know there. But the bill's been passed. It's just a matter of maybe months, or when we get through this pandemic, that you can actually do it at this point in time. So it's now legal. Five avenues that you can legally gamble on now in Illinois. Also, part of the legislation that Governor Pritzker brought through last year was adding 6 new casinos. 6 new casinos. Also, using the existing 10 with the horse tracks that we have in Illinois, they are planning to collaborate, to combine, to create what we call racinos. Racinos are kind of big up in Canada. A racino is combining a casino and a horse track, where you can bet on the horses or go inside and play, electronic gambling machine, or play a hand of poker. So those are in the mix too, with the continued slot machine, electronic gambling machine industry still growing. We still have the most. All that legislation, those 4 avenues plus the one with the legalized sports gambling, is why the Illinois Department of Human Services has had this training push, why we're working with them to do all these webinars, to do all these workshops, and do them for free. Remember, these are for free. So we think the Illinois Department of Human Services, we want to be prepared, because when there's more legalized gambling, there's a better chance that there might be some more folks who need help. That doesn't mean prevalence rates are going to necessarily rise, but that does mean that we should be prepared. Better be prepared, right, than to rest on our laurels. And we have a lot of folks who need help, and we don't have a lot of folks who are certified. That's why we're doing this. We want to get you ready, and perhaps for what's coming, and to get certified. So, and this was even before the pandemic, right? We've increased the webinars because of what's happening with the workshops with social distancing. So here's our learning objectives. And while I'm remembering, and I want to check, let's check. I had a chat here, and I'm checking the chat. And now there are gambling apps for phones. We are immersed in it, and I agree. It looks like it's Melina. Thank you, Melina. Yes, we are. It's all around us, gaming and gambling. So, so what I do want to say, folks, is remember today, to get your CEU, you have to be on the call for the entire time, and you have to be able to answer the polling questions. So if you have any questions about that, please, ask me after, shoot me an email, you can call me or what have you. So, but if you're just listening in, please, enjoy and try to soak in what you can. And these are all recorded and put on weknowthefeeling.org. Okay, so let's talk about why we're here today, right? Our learning objectives, number one, is we want to learn about 2 scenarios that can make a problem gambler more vulnerable to suicide? What are those two scenarios? What do they look like? We want to learn about the two more dangerous comorbid conditions with problem gambling that are connected to higher rates of suicidality. Whether you knew it or not, comorbidity is the rule versus the exception. But I'm going to talk about two comorbid conditions that are more dangerous. And then there are two screening tools. Well, two, it's kind of one. You'll see what I'm talking about that actually address suicide ideation or self-harm. Do you know what they are? If you don't, you will know by the end of today's talk. Okay, I'm having a problem. There we go. Okay, now to reach those learning objectives, there are 4 areas of focus for today's call. First, we're going to look at prevalence rates that either potentially connect suicide to problem gambling or rates that are connected to suicide and gambling disorder. Then we're going to look at 3 considerations that when we're looking at suicide and problem gambling that we need to consider. Specifically, we're going to look at the impacts of financial devastation that's connected to gambling. We're going to talk about shame, okay, and its difference from guilt. We'll talk a little bit about guilt, but more so about shame, and examine the adverse effects it has on the problem gambler. Then we're going to look separately at impulsivity, how poor impulse control and suicide and gambling, how they intersect and how that's very dangerous for our gambling clients. Now, I've resourced some great research for this second section, okay? Namely for shame and impulsivity and that connection that they both have with gambling disorder. I also found a research study that examined cases of suicide of problem gamblers versus cases of suicide of those who just suffered from some type of mental health disorder. It compared their histories and their psychopathology, and it draws some conclusions. Okay, so there's a whole lot of research that I've added into this one. In the third section, we're going to look at the more dangerous comorbid situations that I just spoke of. We're going to touch briefly on that. And in the fourth and final section, I ask that you put on your crisis clinician hat, okay? If you are a crisis worker, if you've ever been one, we're going to review some of those very important points that I feel that you have to hit on when doing a crisis intervention with a problem gambler or anyone suffering from suicide ideation. Now, I did use a lot of slides from our Morneau Chappelle webinar library, but on this one, I'm really enthused, I'll say, to present some just new things that I found in additional research, okay? Hey, look, I know this is a dark subject matter too, just on what I just talked about, right, with the research and everything, but I think as clinicians, it's something that's very relevant and necessary that we discuss, okay? Especially when we work with problem gambling clients. And when I review some of the prevalence rates that are out there, you'll know why. So it's one of the more higher prevalence rates with this addiction than any other. I know that some of this is going to be a review for you. I know hopefully some of this, better yet, might be new, but either way, I hope you can use this to serve our problem gamblers in Illinois, either in your practices or agencies. Here's an example of a slide from a curriculum that we put together a couple years ago. I actually presented it to you guys a couple years ago on a violence and problem gambling webinar, but I tweaked it a little bit to meet this one a little bit. And this is suicide is violence, right? But when we compare gambling disorder to other addictions, I think you can agree it's an underserved population with resulting in noticeably awareness levels and treatment options. Yet gambling has been linked to higher rates of suicide and potential violence. Now, these violent consequences, I think, need to be considered when we're intervening with or treating a problem gambler to protect him or her, their families, and our communities at large. Now, the obvious point here is that despite lower prevalence rates, lower awareness levels out there, even in our field, and with saying the potential dangerous connections, namely suicide, this is the very reason we must keep in mind and consider and discuss when working with problem gamblers and beyond. And when I say beyond, I'm referring to prevention efforts, right? Prevention efforts and also building awareness levels in our community, our communities in Illinois, our professional communities in the mental health industry, and especially when we look at all those increase gambling venues. You know, we're not for or against gambling at Morneau Chappelle. We're not for or against the legalize of sports gambling here. But what we are here to do is to inform you, help you, and even ourselves to serve this population and to treat them, right? Because that 2.5% of folks suffer from this. It can be deadly for them, right? So the World Health Organization defined self-directed violence as there were two types. One was self-abuse. Now, we're not going to talk about SIB today, self-injurious behaviors. We're going to talk about suicide today. That's what we're going to stick to, and I think prevalence rates are a good place to start. Now, again, I resourced this for the violence webinar that we did earlier, a couple years ago. And this Dr. Crunk is a psychologist. He's actually a writer for the Knoxville, Tennessee paper and also the USA Today. He made several of these points when I was doing some research on the Vegas shooter, and he did a lot of work on that. So that's why I found a lot of his stuff in what he reported. One being 5% of all suicides are related to compulsive gambling, as are 17% of emergency room settings. A 2003 study in the Journal of Clinical Psychology found that 4 out of every 10 compulsive gamblers in a gambling treatment program had at least one prior attempt. I think Dan Trolero, he might have quoted that same number last Tuesday in his webinar. Now, I know 1997 was 23 years ago or 24 or however long, but I thought this was important too when they had compared gambling cities, 3 of them of the same size, Atlantic City, Las Vegas, and Reno, to other cities that were comparable non-legal gambling centers. The suicide rate was 4 times that, okay? And Vegas at the time was the highest in the nation. And out of all the addictions, gamblers have the highest suicide rate, according to Crunk. A 1995 study noted that 7 out of 10 compulsive gamblers had contemplated suicide and 1 out of 6 had made an attempt. GA reported 20% of its problem gamblers had attempted suicide, not ideation, attempted suicide. We also managed the North Carolina problem gambling helpline, where we resourced and found that 11% had considered suicide. So there's a very high proportion of who are at risk for suicide when we're looking at the gambling or problem gambling population. Another study showed that U.S. gamblers owe on an average between $55,000 and $90,000. Now, our problem gamblers are very vulnerable when they are either at their financial bottom, or they actually get caught. That's your first learning objective, remember. So the 2 times are one, when they're at their financial bottom or when they get caught. Because we know that with most gamblers, money's their drug. It's everything for them. So when that well runs dry, it's like their morphine running dry. It's like they get to the bottom of their bottle. It's a very dangerous time for them. And also, when a gambler's facade is actually penetrated, or when they're found out by a loved one, a spouse, then they often view their gambling run or gambling lifestyle or high over, which is another deadly time for it. Could be a potentially deadly situation for them. So we're going to talk a little bit later in the hour about a comorbid disorders and their dangers, a particular major depressive disorder. I'm also, again, going to speak on impulsivity and problem gambling in a few slides. You know, it definitely has a connection to risk-taking and gambling and self-harm. And finally, just because you don't see the visible signs of an addiction or a mental health disorder doesn't mean that they're safe or they're okay, our clients. Gambling disorder is referred to as a hidden disease for the very fact you won't see track marks, you won't see dishevelment, you won't see or smell whiskey or marijuana. Well, you might, but for the most part, most of the characteristics of gambling disorder and problem gambling behaviors can be covered up and hidden. So we've got to be diligent in asking our questions, even our questions about self-harm. Now, there was a study at Lund University in Sweden, 2,000 participants, 11-year period. They found that suicide rates increased 19-fold among men between the ages of 20 and 49 if they had a gambling problem, by 15 times among men and women of all ages. Now, Dr. Andres Hackinson, a professor of addiction at Lund University, stated it wasn't surprising to him at all. The causes of suicide were more likely to be multifactorial, and some of them will contribute to more than others being the factors, okay? He went on to say that gambling contributes very strongly to suicidal thinking, especially with debt. And when there's a debt connected to loved ones. And that leads me to our next section that we're going to talk about with suicidality and gambling, and that's shame. Here, Dr. Hackinson is referring to the shame and the debt of the problem gambler has, the effect it has on their family and the shame that it causes, okay? So we're going to talk about that, but before we do talk about that, let's launch our first polling question, which asks, gamblers are most vulnerable when the following is true. We just went over this. This was our first learning objective. And is it A, when they are winning? Is it B, when they hit their financial bottom? Is it C, when they get caught? Is it D, none of the above? Or is it B, both B and C? Gamblers are most vulnerable when the following is true. Is it A, when they are winning? Is it B, when they hit their financial bottom? Is it C, when they get caught? Is it D, none of the above? Or is it both B and C, when they hit their bottom and when they get caught? I'll give you a couple of seconds to answer. I don't know if you guys have seen on TV as you're answering, Jimmy Kimmel's doing the Who Wants to Be a Millionaire. That's who I just felt like when I was asking that question. All right, T minus 10. We've got 77% who have voted. Most of you are getting the right answer. We're at a minute, and I've got a lot to cover here. So we're at 83%. I'll give you 5 more seconds. Okay, folks, good job. 71% got it right, and it was both B and C. Remember, our first learning objective stated, hey, gamblers are most vulnerable when they hit their bottom, when their drug's gone, or when they get caught and their facade is up. They're at their end of the road a lot of times, so they're very vulnerable at those times. Okay. For this section, this is the section I was telling you about where I'll resource some great journal research and journal articles. A few of them we are using are from Dr. David Ledgerwood, who works with us on some of these webinars. He's a leading researcher in these fields. And some of these he actually did himself, so you'll see. You know, one was on shame and guilt that I'm about to cover. I found that other one that I told you about that compared the histories and characteristics of the suicide cases of gamblers versus non-gamblers with mental health history. Now, I do want to apologize in advance for the sea of print on some of these slides. They're very text heavy, not this one, but the ones that are coming. And I'm going to stick to summarizing the studies for you and just trying to give you the takeaways. But again, I apologize for all the text, but I wanted to get it all out there for you. But I think as clinicians, we have to be prepared to counsel, guide, and comfort our gambling clients through these things. The financial devastation, the shame, and the guilt that are connected to what happens with financial devastation. And even on a separate highway or another lane, the poor impulse control that is inherent with, I think, most addictions, right? With gambling, perhaps maybe being even one of the worst, but we'll look at some studies that talk about that a little bit more. Okay, here's our map of destruction that outlines a trail of destruction, or a trail of financial destruction. It includes loss of savings, credit rating, home equity, and loss of retirement. But we want you to remember too, if you're new into this field, they have some unique financial, we'll call them challenges as well, like threats from loan sharks. You have to be able to help and guide and counsel our gamblers through the financial devastation and even threats from loan sharks. While they're not common, they're real. You know, it's a riches to comfortable to rags story, and the financial damage can last for many years beyond after the gambling stops. So be prepared to work with your gambler through the debt, okay? Through the debt, because sometimes the debt is for a lifetime. That debt can be a nasty trigger. That debt can also feed into the distortion, but that they can remedy that bet with a relapse. It gets very complicated. So know that the debt is something you're going to be working with your clients. It affects 8 to 10 significant others, okay? And in some states, the significant other may be liable for the gambler's debts. Now, this all includes those areas that I just showed you on our financial destruction map. And I want you to think about it. Think about debt and what it does to families. It haunts them, their families, their friends, their loved ones, and the gambler. And it just doesn't go away, as we just said. Think about if it, even if we empathize and think in our own lives, if we came home and our partner, spouse, wife, husband had gambled everything away, all our savings that if we had worked together on at no fault of your own. Think about the look on a child or a teenager's face who's a junior or a senior that lost their full tuition fund on a sports bet, right? All this leads to our talk on shame. Now, as you know, there's a difference between shame and guilt in counseling clients through coping with these two distinct affective states. But shame and guilt are also distinct in the relationship to problem gambling. I mean, that our problem gamblers utilize gambling as an avenue to maladaptively cope by escaping or avoiding the feelings associated with shame through playing like a electronic gambling machine for 2 to 3 days straight, or putting their mortgage down on a sports bet, But guilt, on the other hand, it's more associated with the more motivating adaptive coping tools like corrective action to deal or remedy those feelings that are connected to guilt. I mean, guilt is feeling bad about an action that you did, where shame is more connected to one's self, their soul, right? In fact, this study indicated that the relationship of using gambling to cope with shame played out into the levels of a client's gambling severity versus that of guilt. So there was a relationship between the levels of gambling and shame and how they use it maladaptively to cope. The final results of this study recommended that counselors coach their clients to use more adaptive coping skills in order to prevent problem gambling behaviors. And because those behaviors were such a custom fit to meeting those feelings of shame. Now, this study also detailed the intensity of shame, the effect it has on our clients, connecting shame to several maladjustment symptoms like anxiety, depression, low self-esteem, other addictive behaviors, and of course, violence. And that violence can be directed to others or upon themselves. Shame has also been considered more intense and agonizing when it's compared to guilt. Clients can begin to chase their tails by using gambling to escape the painful awareness of shame, while the gambling also becomes the source of the shame itself, right? It creates a dangerous self-defeating cycle that can lead to suicidality because of its intensity. Now, finally, shame has been found to be the emotion tied to self-hatred. Now, I know most of you on this call work with folks in the substance addiction disorder field, right? And you know that a lot of folks who are addicted to anything have this self-hatred thing going on, right? And when it's gambling, okay, when gambling intensifies the emotion of self-hatred or hating oneself because of causing all the pain, let's say, of a family's financial devastation, it can be really dangerous, especially after I said a big loss or after being found out. Okay, so shame is very intense. Again, shame is stuck to our client's soul. It's not like guilt over an action we did. It's what they feel they are, right? Based on, this illness, this disease, this disorder. Okay, so now let's talk a little bit on a separate lane, impulsivity. So we've talked about financial devastation, right? Its connection to shame and guilt and how it can be dangerous. But when we speak on impulsivity or poor impulse control, we're talking about taking action without forethought or not thinking things through or considering the dangers or consequences of certain actions, like taking morphine or methamphetamine or opiates to escape, right? Or placing their family savings on a bet or to get them out of trouble with a loan shark or a creditor, or even suicide, ending their own life, not thinking of others or even themselves because of the pain and not thinking things through. As this slide shows, impulsivity is inherent in substance use, gambling, and suicidality, right? So it has that's that connection with gambling, being inherent with gambling and suicidality. And if you're serving folks addicted to substances, you have to be on the watch out there as well. Now with gambling, we're connecting it to money, and it can really hurt a lot of other people, and that's where the shame comes in. Now, there is a common genetic entity element of impulsivity between the axis to antisocial behavior, personality disorder, and gambling disorder. Now, this is a study that Dr. Ledgerwood did, and this was actually within the study. But I want you to keep this in mind, the connection between the axis to the antisocial and the gambling disorder, because I'm going to talk about it here in a quick second. But lest we forget, the gambling disorder was actually, to further this connection, characterized under the impulse control disorder family for many years in the DSM-4, right? Remember, you know, where folks our gambling clients had difficulty in controlling their impulses despite losing everything. Now, let me go backwards here. The common genetic entity element of impulsivity and antisocial behavior and gambling. If we go back, if you have been to the 4-day core gambling workshop, we talk about the pathways model. It's Dr. Alex Blasinski. He even dedicated one of his typologies to antisocial impulsivist gamblers. In fact, that's the name of the typology, okay? This subgroup is marked as the most challenging to work with and usually responds poorly to treatment. They experience severe financial difficulty because of their binge-like behavior linked to their poor impulse control, right? They also have an increased risk of self-harm, you guessed it, and they also exhibit criminal behaviors. So that's kind of the connection there between the criminal behaviors, impulsivity, and gambling, which I think we can take that another step further into suicide, not using forethought, not thinking things through, right? Okay. So there are 2 more studies I want to talk about here real quickly. And the first was the one I've been telling you about that compared suicide rates of problem gambling participants with those with just other mental health issues. Obviously, if they harm themselves to the point of death, they had some mental health issues. So it had 2 sets, one with the problem gambling and one with the mental health piece, okay? They focused on their psychopathology profiles and also who sought treatment, okay? And that's kind of the takeaway here I'll get to. The psychopathology, both groups were comparable, okay? With the exception of gamblers having a cluster B personality disorder. Just so you know, cluster B is borderline histrionic and narcissism or narcissistic personality disorder. The folks with gambling problems had, I guess, more of that. And I'm sure if you work with gamblers, you might agree with that, you might not. Problem gamblers are more prone to addiction and they're more prone to comorbid disorders. Now that's the pathology piece, but both groups were marked for low treatment service rates, but more so with problem gamblers. In fact, only 2% of the problem gamblers who had committed suicide, when compared to the suicide cases of the non-gamblers, only 2% of the problem gamblers went to treatment, okay? So why? Why did this happen with the gamblers who had committed suicide? Well, there's that dirty word shame right there, you see. They also a lot of them were in denial. A lot of them took their financial crisis more importantly than getting help. You know, gambling's an isolating activity. They didn't want to be around people. It's more secretive and, you know, they didn't want to give it up. Now, some of the recommendations from this study said there should be an emphasis on assessing an early intervention of comorbid conditions, especially major depressive disorder. Also, there should be strong prevention efforts in countries, and I'm going to say states like Illinois, where there are higher levels of legal gambling. Also, or gambling accessibility is what the study actually states. And then we also need to do some just research into more research why problem gamblers don't seek treatment. Finally, we need to improve our suicide prevention calls with more mental health specialists. Okay, so that was the first study talking about pretty much the low amount of problem gamblers that went in who had actually committed suicide, their lower treatment levels. Now here's a second study in our last study that covered the Connecticut Council Problem Gambling Helpline, which we at Morneau Shapell, we conduct that one as well. We help them with this one. There were 252 callers. This is a study Dr. Ledgerwood did as well. Out of those 986, the 25.6% reported suicidality, and they were more likely to acknowledge family, financial, legal, and mental health and substance-related problems. But here again, were less likely to report prior gambling treatment. Here's some characteristics of those 25.6 that reported they were suicidal. They reported more debt, more family problems, more financial problems, more arrests, more anxiety, more depression, and they were more likely to report treatment for alcohol and mental health problems, but not with getting treatment for their gambling problem, which I found interesting. Characteristics of this 25.6% that reported suicide attempts where they were non-Caucasian with lower incomes. They played the lottery. They report actual arrests for illegal behaviors. They were less likely to report gambling treatment again, and they were more likely to report a history of alcohol use problems. And when we compared out of the 25.6 of these callers that said they were suicidal at one time, compared to those without suicide, I think that was out of all 900 and somewhat callers. The suicidal callers were more tended to be non-Caucasian, lower income, bankruptcy involved, high debt levels, service of debt, family problems, stealing to support gambling as well. Now, I think the takeaway here from this study, and it ties into that first study with the suicide cases, is it showed the more severe the gambling-related problem for the helpline caller participant that reported suicidality, the ones who primarily were the attempters, the less likely they will report for any treatment or self-help exposure. Now, if I go back to a few slides, remember it listed these reasons for shame, denial, putting their financial crisis before getting help, gambling being an isolating activity. It's secretive to them. They wanted to keep gambling. What that tells me, okay, so this is saying the higher the gambling problem or the severity of the problem, the lower the treatment rates. So that tells me, as counselors and clinicians, of folks that come into our offices in the contemplation and pre-contemplation stage, we need to really utilize our motivational interviewing skills, right? I would think we need to move them along that spectrum if that's okay. We can't shove or push too hard, I know that. But if we can get them to the action stage to get them some help, maybe they have a better chance, right? And then also during the maintenance stage, we need to be diligent to always just kind of follow up with them to make sure that they're okay. Okay. So that was all our research and some considerations that we need to look at. Now, here comes our second polling question. If I can, whoops, pull it up. Whoops. Let me get back here. Okay, sorry guys. Okay, let's go to the second poll question and launch it. And it's true or false. And it asks, there are usually 8 to 10 significant others that are negatively impacted financially by a problem gambler's action. This is easy, right? True or false? 100% so far. Knows this one, and this was just on the slide. There are usually 8 to 10 significant others that are negatively impacted financially by a problem gambler's action. Mark A if it's true, B if it's false. 77% have voted. 78. Can we get into the 80? Yes, we can. 81%. I'll wait a few more seconds. Okay, guys. It's true. Usually 8 to 10 significant others are negatively impacted financially by a problem gambler's actions. So that tells you that family treatment is going to be a booger, right? Well, and it's the shame. What I'm trying to get over here today is it's the shame that's involved, that's connected to financial devastation to loved ones and to themselves, you know. And it's the guilt too, but I think shame is more intense, you know. And that's why we wanted to cover financial devastation. That's a review for you guys, most of you. Connect the shame to it. Heap on impulsivity, poor impulse control. I mean, it can be really dangerous. So let me real quickly go through comorbidity and suicide with problem gambling, okay? Now, as you probably already know, and I already made this statement, comorbid addiction disorders are the rule versus the exception. It can be considered a rare condition for a gambling disorder to stand alone. That doesn't mean it doesn't happen. It just means that most times, case in point, here's the NESARC study that was the largest study in the U.S., or with U.S. adults anyways, on co-occurring psychiatric disorders that had 43,000 participants. It ranked the following. Now, number one was alcohol use disorder. I was on a webinar last week that said it was it reported 73.5%. Either way, the top one's alcohol use disorder, followed by access to disorders, personality disorder, then depression, anxiety, followed by drug use disorder and bipolar. Now, this study also showed that problem gamblers have a higher prevalence rate of depression, anxiety, substance use disorders, and suicidality when compared to the general population. Surprise, surprise, right? I mean, this thing financially crushes families. Those with psychiatric, co-occurring psychiatric disorders have more serious financial, legal, social, vocational problems connected to their gambling when there's a mood disorder connected to it or a substance use disorder. These comorbid conditions likely affect, relapse and treatment. I mean, think about someone who suffers from alcohol use disorder, taking a drink, who also suffers from, gambling disorder, get some alcohol in them, their inhibitions, lowered, and then they're off to the races, literally. So we must make sure that we're assessing and screening for these comorbid conditions. But I want to talk a little bit about the connection that comorbid conditions with problem gambling have to suicide. Now, this is a study that Dr. Ledgerwood did that agreed with the NESARC study, and it connected it to gambling-related suicidality. He said, in the present study, we found more frequent acknowledgement of substance use problems in gambling-related anxiety and depression in problem gamblers with gambling-related suicidality. He went on to say that gamblers with gambling-related suicide attempts were more likely than ideators, just thinking about it, to report positive family histories of alcoholism and drug abuse, and family histories of drug use and gambling problems were more frequently acknowledged by callers with gambling-related suicidality by those that were without. So this study made those connections with problem gambling, then the comorbid condition, and that condition being connected to being suicidal, primarily with two types of comorbid conditions: mood disorders and substance use disorders, right? Now, the most dangerous is probably mood disorders, especially major depressive disorder. On top of the clinical symptoms, think about the collateral damage, particularly financial, that problem gambling, when it's heaped on depressive symptoms, what could happen? I mean, all addictions cost money. I know that, but it's that direct relationship to gambling and that loss of control aspect that really can put people in some bad spots. Think about a client who loses a parent, goes through a divorce, and then loses everything financially on a gambling binge. Or think about, a client who is a widower and loses everything in the casino on a 3-day binge, and then isolates with her depressive symptoms. So it can be a very dangerous thing, comorbidity, especially with mood disorders and with substance use disorders as well, those two conditions. So that brings us to our third and final poll question before we get into our last section. Gosh, I'm just having difficulties today. Here we are. Now this one's a little bit, I tried to word this. So read it carefully and you'll get credit whether you get it right or not, but read it kind of carefully. And it asks, which of the following statements on problem gambling and comorbidity that we just went over, which of the following statements are untrue? Is it alcohol use disorder is ranked the highest comorbid condition in the NESARC study? Or is it B, comorbid conditions are common with problem gambling? Is it C, mood disorders and substance use problems are very dangerous when comorbid with problem gambling? Or wait a minute, is it D, all these are true, right? Okay, which of these are untrue? Is it alcohol use disorder was the highest comorbid condition in the NESARC study? Was it comorbid conditions are common with problem gambling? Or was it untrue that mood disorders and substance use problems are very dangerous when comorbid with problem gambling? Or is it D, these are all true? While you guys are answering this, we're making some pretty good time. I know I've been talking fast because I loaded this one up. This is a new version, or really a new webinar for us. So I hope you're enjoying it and you're getting something out of it. I'm going to try to save the last for maybe some questions. Okay. We have 77% who have voted, 80%. So the answer is D, all the above, okay? All the above are true. Comorbid disorders and substance use problems are very dangerous when comorbid with problem gambling, of course. Comorbid conditions are the rule versus the exception, and alcohol use disorder was the highest rated comorbid condition, right? Okay, I'm going to check in with the chat. I got a couple of chats. Enjoy. Okay, thank you. Hey, Mary. Okay, so let's go on to our last section. Now, this final section, we're going to include a review on crisis intervention, screening and assessment, okay, a review. And perhaps maybe if you've done this before, it might tweak some things in your memory because we want to make sure that not only our problem gamblers are safe, but all of our clients are safe. And then I'm going to cover a couple other things that we need to be mindful of in keeping our problem gambling clients safe in these initial stages of contact. Now, the first thing I want to cover comes from Dr. Tim Fong of UCLA. Now, we work with Dr. Fong with the California Problem Gambling Line. I just heard him at a recent conference first week of March, right before all this COVID-19 stuff escalated. So we got to hear him talk, and he talked about, he had a couple of slides on reducing the risk of self-harm. This is when I was writing this, and I went, I better get my pen and pad out and take some notes. And I did, and he had some great things to say, okay? So the first thing he talked about, now these are all things that how we can reduce the risk of self-harm on our gambling clients. And the first thing he covers, well, they're all really simple. The first one was the SCOUT motto, be prepared. And when I say be prepared from everything from ideation to getting your client to a safe spot like an emergency room setting if they are dangerous to themselves. How can we be prepared? You guys all have done this probably a long time. You've probably always had, you might have had a suicidal client today. I hope not, but you know what I'm saying. It happens in our field. I know when I got into this field, I came from crisis work in an emergency room to answering the problem gambling lines at BDA. And I thought, glad that's all over with. I was caught by surprise, right? And we want to make sure that we know what to do. And of course, it's surprising, it's disturbing, but we've got to be prepared for it, right? So just know it could be coming, right? So have a plan, know what to do. If you're in an agency or an office, just know what the protocol is. And of course, know perhaps how to assess, get trained, know the things that you need to do to help these folks that suffer from ideation out. The next thing is enable an environment that reduces the stigma and shame of someone who actually has suicidal thoughts or who have. This way your clients won't try to hide their ideation, which can ultimately be very dangerous, right? There's some shame involved, and a lot of times they don't want to go to the emergency room. They say, hey, look, I don't want to say anything wrong. I don't want you taking me in. Well, that doesn't necessarily mean we're going to take you in. I mean, we will, but just because you have an ideation or a thought doesn't mean that we have to get you to a safe spot, and then you can, but just make sure that they feel safe talking to you about it. On the other end of the spectrum, realizing that suicide isn't always the inevitable result of gambling disorder or major depressive disorder or any other mental health disorder to speak of. It doesn't necessarily have to happen, right? And also increase your education on the topic, like what you're doing now. Attend webinars, conferences, do your own research. Believe me, after preparing for this webinar, I found there's a lot of valuable recent information and studies on suicide. Try to coach the well-being of your problem gambling clients, particularly those that experience ideation or have a suicide attempt history. Provide a balanced lifestyle focus for them, and just let them know, I do this with folks with all addictions, let them know to be patient with their new activities and new lifestyle, because it takes time, even biologically, for our bodies to learn how to enjoy them, right? It's not all going to be about losing or winning thousands of dollars. You know, your body's going to eventually change to where they're going to enjoy things like spending time with their family, going to dinner with their spouse or loved one, right? It just takes time. and they'll find new ways and new avenues. And finally, try to keep an eye out to minimize all those opportunities for a client to hurt themselves. Especially those with an attempt history, always check their family attempt history as well. Okay, now you're going to either want to guide them to get rid of their, to get rid of their access to things like guns, sharp objects, and pills, or, have them get rid of them to a loved one, especially during some vulnerable times when you see the cycle of depressive symptoms start to escalate, right? And an interesting takeaway from Dr. Fong that day, he talked about what he told us, he shared with us the top reason that his clients at UCLA, his gambling clients, reported for their suicide ideation. What do you think it was? It was anxiety. That intense anxiety or worrying about potential things that could happen to them, either if it's gambling related or not, but the gambling served to kind of soothe that, right? That kind of feeds back into our comorbid conditions and the dangers of mood disorders comorbid with gambling disorder. Okay, so what do we do when we have someone with suicidal thoughts? Let's take a step back into Crisis Intervention 101. Suicidal history. Check their history. Check their family history. Have they ever had a plan? Have they ever had an attempt? Have they ever had thoughts before this? If yes, how long ago? Do they have comorbid diagnoses like a mood disorder? What are their key symptoms? What is the precipitating event, right? That's a good start. I mean, did they lose everything? Was it their spouse telling them they wanted a divorce? Did they lose a job connected to their gambling? Where's their level of hopelessness? Do they experience poor impulse control? Are they feeding into a distortion? We need to know all these things. Has there been a change in their treatment? Are they in treatment? Have they been discharged from treatment? Was there a medication change? Any type of treatment changes. If they went up or they went down, if they went from IOP to outpatient or if they went from IOP to inpatient. Again, check those access to firearms. Ask the question, especially if it's on the phone. Guns, pills, all these things. And then moving to protective factors, internal and external. Internal, do they have coping skills that perhaps if you're seeing them, you'll know more on that? Are they religious? Are they spiritual? What are their actual pain tolerance levels that you know? And if you don't know, perhaps you can start that conversation. External, do they have children, grandchildren, pets, parents, social supports? All these things can matter to bring up in a conversation at this point in time, because you may have to coach them to use that, leverage that to stay alive. Are you or will you be with somebody in the next 24 hours? Check their safety, right? And then moving into suicide inquiry, we need to check their ideation first. Frequency, intensity, and duration, right? And we need to be able to scale that. Use the Rolnick ruler, 1 to 10, right? On 1 to 10, if someone had tried to commit suicide 6 months ago, that's obviously a 10. Where are they at today? If they are a 7 or an 8, that might be a hospital stay, right? But we need to check the frequency. How often are these feelings coming? How intense? Scale that, okay? How long are they lasting? Is it passive ideation? Is it one of those feelings of being, I'd just rather be off dead, rather than just really actually thinking about taking action? Talking about the plan, figure out the timing, the location. Have they already started the plan? Have they made purchases of the plan? Is it lethal behaviors, past attempts, aborted attempts? Again, have they already started into their plan? Try to find out all these things and always document, always document. In the hospital emergency room, we always had to document just for the sake of justifying it to the presenting ER doc. Hey, this is why we should keep them, right? So always document for obvious problems. Now, this is where your clinical judgment comes in, starting with low, okay? The protective factors at the low level, they've got high protective factors, family, friends, they might be spiritual, religious, positive coping skills, but they might have had a big gambling loss. They may have some passive ideation, right? Like, man, I just feel better off dead. I would never do it. But you know what? Here, it might be good to make an outpatient referral, or I think it would be appropriate to do an outpatient referral and provide the crisis number. If we step up to moderate, someone who's feeling on the scale 5, 6, 7, then there's a big, usually financial loss, potential divorce, loss of job connected to gambling. They might actually have a plan. They might have a history. but let's say they don't have really intent to carry it through. Look, this is where we really need to check out their intent, their plan, and their history, right? We need to see how intense this is. And if our gambling clients severe symptoms with an attempt history at all, they've lost everything, their spouse is leaving them, of course, we're looking at an inevitable ER admission. Now, look, this has just served as a review for you guys with crisis intervention work. And in no means is intended to be hardcore training, of course. If you do crisis work or if you've done it, that it takes hours of exposure and hands-on experience with great clinical supervision. I personally think an emergency room setting is the best training ground for this. This is some dark work and it's tough work, but it's very rewarding. But I just wanted to scratch the surface here and give you a review in the case that you run into this with our gambling clients. And here, finally, our last slide. Here are the screens and tools. This is our last learning objective too. These are screening tools that we use, that we talk and we discuss in our 4-day workshop. Now, which of these tools do you think actually touch on self-harm and suicide? It's actually the GA20 and the Gam-Anon 20. The GA20, question 20 asks, have you ever considered self-destruction or suicide as a result of your gambling? And question 18 on the Gam-Anon 20 asks, does this person ever suffer from remorse or depression, sometimes to the point of self-destruction? Okay. Again, I know this is a dark subject, but I think it's important and relevant that we cover it and that we know what we should be doing. We reviewed that. But the reason we cover this is that the condition is called an invisible disease or addiction for a reason, right? A lot of things are covered up until it's too late. So make sure we're staying diligent at all levels of intervention and treatment with our problem gamblers, even if we don't see, hear, or smell any characteristics right out at us, okay? All right, guys. So I've got a lot of questions. We got a couple of minutes. Let me see, and we can even go a couple of minutes over. Let me go to our chat first. Okay, hey Marie, this comes from Marie. I found some very good apps for suicide prevention. My3, that's MY3 and Virtual Hope Box. They're evidence-based, good stuff. Yep. And not everybody's done crisis work or, and if you haven't, believe me, I actually interned at Boston College and then just stayed on with it for a while. But it's good. It's good work. It can be dark, but it can be very rewarding as well. Okay, so Colleen, hey Colleen, are the studies that examine the antisocial symptoms and measuring their shame? Are there studies that examine, the antisocial symptoms and measuring their shame? One could hypothesize the more severe the antisocial tendencies, the less shame or possibly, oh, good point, very good point. Yeah, I don't know, Colleen. So she was asking if there's any studies that examine when there's, the thing with antisocial personality disorder, one of the things is the absence of guilt, right? So what does that do with shame? Is there still shame with our antisocial folks, and are there studies? I'm not sure, but that's something to look into. Good question. Anonymous attendee asks, can you remind participants of the 1-800-GAMBLER line? Also to ask a couple of screening questions for those contacting their agency helplines reporting depression and other issues where they may not mention gambling. Hope that makes sense. I can give you the 1-800-GAMBLER line, and I will tell you on that line, I know I had to do some crisis work on the line, so that happens, unfortunately, more than you think, more than I thought would, because remember, I got caught unprepared, and that was one of Dr. Fong's points, is just be ready for it, don't dread it, just be mindful of it, just know it's there and that it could come, and be prepared to help them, save their life, do whatever we need to do to keep them safe. So let me flip back up for you guys. And hey, we're a minute past the hour. Thank you for everybody who was able to be on today. I'll go over a little bit here, but thank you for being on today. And we look forward to hearing from you next April 28th on Dan Trollero's webinar. And his webinar is, as I'm looking up the Illinois Problem Gambling Helpline, is going to cover Uh, you know what? I don't. We'll pull it up here. Okay, so let me find. Okay, please join us. Risk Gambling and Criminal Justice Day, and we'll cover that next week, April 28th. We hope to hear from you. So if you have to drop off, thanks, guys. There's the 1-800-GAMBLER line for Illinois. And yes, we have to do crisis clinician work on there quite a bit. Okay, let me see if I've got any other questions. We got a third question. We got some more chats too. Okay, thank you, Adrian, for joining us today. Oh, we got a lot of chats. Okay, certificates are coming, guys. I'm going to start sending out some evaluations, but we're way behind, okay? So bear with me on that. First, just fill out these evaluations. I'm up to March on the evaluation, so hopefully that's going out. And we're getting some traction now. So in the coming weeks, we're going to be getting you all these certifications. Email me if you need a letter because of a license expiring. Okay. All right, guys, I think that's all the questions in the chats. Again, I appreciate everything. I hope this was helpful information for you, and I look forward to hearing from you guys in the future. And okay, yep. Again, we'll get all the evaluations out, guys, okay? If you have any questions about it, just shoot me an email or call me. Okay, everybody have a great day. Thank you.